I would like my muscle wall to be repaired ASAP, but if I still have a little bit of weight to lose after surgery, would that be okay? Let's say 1 stone. Again, muscle wall repair would be the surgeon, the general surgeon, rather than us, the plastic surgeon. So whether they do it when you've still got a bit of weight to lose would be up to their discretion. But in general terms, surgery is better when your weight is less. The tension will be off things, the repair will be tighter. So it is generally speaking better to do it when you have lost weight. And certainly the tummy tuck, if you're having a tummy tuck, for sure that is better to have once you've lost the weight, because if you have the tummy tuck and then you lose weight, you can get a bit of redundant skin. Not to mention the fact that your risk of complications, or we talk about hernia, hernia on the mind, talk about infection and what have you. Your risk of infection is higher, risk of wound breakdown is higher, so the complication rate is higher if you have if your weight is higher. So the ideally you would lose the weight first. I guess it depends a bit on where your weight is and what sort of timescales you're looking at. I don't know, you're saying you want it ASAP, but yeah, in general terms, for this sort of elective surgery, these you want to be in your best condition. So having your weight right first, and as I say, undiagnosed abdominal pain is probably not great. So it sounds like there's a few issues here which need a bit of thought and a bit of input, possibly from other surgeons other than plastic surgeons. To be frank, the thing that we do is usually pretty straightforward. You know, the tummy tuck side of things, bit of muscle repair, hernias, abdominal pain, all these sorts of things need a bit more of a bit more thought and a bit more input from a different type of specialist, which would be a general surgeon. So it sounds like you need a bit of input from your general surgeon. And as I say, the sort of stuff that we do, the tummy tuck side of things, is usually relatively straightforward. This one clearly isn't straightforward. This one's not straightforward at all, with all this hernia shenanigans going on. But a kind of inverted commas normal tummy tuck is relatively straight. I mean, I don't want to say it's not a big op. It's a big op, and the risks, etc., etc. But the actual, you know, the actual sort of not dynamics, the sort of like the mechanics of what you do sort of thing is kind of relatively bit of skin removed, bit of muscle tightening, contouring to the abdomen, getting the shape right. You know, it's all superficial surgery, and it's all kind of you know, relatively straightforward. But again, I guess I'm saying that because that's the sort of thing we do, and anything that you do